Hi, my name is Loice Ongwela. I am a diabetes clinical nurse specialist and a certified clinical diabetes care and education specialist. Today, I'll be talking about how to prevent diabetes-related readmissions to the hospital. First, we will talk about what is diabetes and the impact of diabetes on individuals and the risk for hospital admissions and readmissions. Second, we will talk about the impact of diabetes on the healthcare system and on the society as a whole. Third, we will review the risk factors, signs and symptoms, and complications of diabetes. And then finally, we will address how to take care of self to reduce risk of complications and how to prevent diabetes readmissions and related comorbidities. So let's get started. What is diabetes? Diabetes is a chronic or long-term condition that occurs when the body cannot make sufficient insulin or when it cannot use insulin properly. Lack of insulin leads to persistent high blood sugars, which can cause serious health problems. People with diabetes are at risk for many complications, hence the need to understand the risk factors and to prevent and manage diabetes. There are different types of diabetes, which we will discuss. Type 1 occurs in 5 to 10% of all diabetes population. Type 2 occurs in 90 to 95% of diabetes population. And other types of diabetes, like gestational diabetes, is found in 2 to 10% of all pregnancies every year. Secondary diabetes and other types of diabetes due to other health conditions occur in less than 5% of all the diabetes population. So first, let's talk about the pancreas and insulin for a moment. Insulin is a hormone produced by the beta cells of the pancreas and enables the body to use glucose for energy. Insulin has been understood to be the key that opens the cells so glucose can enter into the cell and be broken down into energy. When the pancreas is not making sufficient insulin, this leads to type 1 diabetes. And most of the times in type 1 diabetes, the body's immune system mistakenly destroys the beta cells of the pancreas. Now, what's the impact on the individual? Diabetes causes many health problems for an individual. One, the risk for strokes and macrovascular damage is imminent. Up to 85% of people with diabetes die of heart disease, which is the #1 killer in the country and worldwide. Diabetes is also the #1 cause of new blindness. It causes kidney damage. It's also the #1 cause of non-traumatic amputations. It also increases a person's susceptibility to bacterial as well as viral infections, including influenza and COVID viruses. According to a Healthcare Cost and Utilization Project, in 2018, 8 million people were admitted to the hospital with diabetes. 95% of these people had type 2. And for most type 1s, the principal diagnosis at admission was their diabetes or septicemia, which is the infection of the blood. Type 2 diabetes, people with type 2 diabetes were admitted with septicemia mostly. According to the ADA, back in 2017, the cost of diabetes was up to $327 billion, $237 billion in direct medical costs, and $90 billion in reduced productivity. This cost has been increasing every year, and currently it's more than $400 billion. Most of the hospital cost, 30% of total medical cost, is for hospital inpatient care. Prescription medications and complications treatment take up 30%. Anti-diabetic agents and diabetes supplies take up 15%, and physician office visits take up to 13% of all the cost of care. So diabetes prevalence is increasing rapidly in the society and is becoming a global threat. According to the CDC in 2022 diabetes report, more than 130 million Americans are living with diabetes or prediabetes. This is up from around 110 million just 2 years ago. According to International Diabetes Federation, approximately 537 million adults aged between 20 and 79 are living with diabetes. The total number of people living with diabetes is projected to rise to 643 million by the year 2030 and 783 million by the year 2045. This is truly an epidemic in the society. So what are some of the risk factors for diabetes? There are several risk factors that predispose people in the society to developing diabetes, and these should be avoided to reduce risks. Number one, genetic predisposition is an important factor. However, the modifiable factors should be the focus for prevention of diabetes epidemic. Being overweight and obese are top on the list. Alcohol, tobacco, and drug use, increasing sedentary lifestyles, especially made worse during COVID-19 pandemic, are top factors. And unhealthy eating, which includes foods high in saturated fats, highly refined and processed foods, as well as refined sugars and sweets, are contributing greatly to the increasing incidence and prevalence of diabetes. Extreme stress and anxiety that is also prevalent in the society is an important risk factor. So what are some of the signs and symptoms of people with diabetes, high blood sugar or low blood sugar? One, when people are experiencing high blood sugar, they begin to have increased sensation of thirst, wanting to drink all the time, dry mouth, weakness and fatigue is very common, headaches, blurred vision due to extreme high levels of sugar in the blood, and frequent urination as the body is trying to get rid of the excess sugar. Sometimes symptoms of low blood sugar could also be the first sign that one is developing diabetes, especially when the body is producing high levels of insulin and trying to counteract the high levels of blood sugar. So low blood sugar signs include fast heartbeat, shaking, sweating, hunger, which is extreme hunger, nervousness or anxiety, irritability or confusion, and dizziness. So these signs could be warning sign that something is not right. How do you take care of yourself, and how do you prevent coming into the hospital with diabetes or related complications? One, healthy eating is very important. Eating foods that are high in whole foods, such as vegetables, fresh whole fruits, less processed foods, whole grains, as well as foods like nuts and grains are known to have high fiber, and these foods are also very important in helping you develop general health, but they're very important for people with diabetes. Being active is also very important for people with diabetes. Moderate to high level physical activity, such as walking 30 to 45 minutes daily, is very important for people with diabetes. Increase your intensity of exercise as much as your health allows. Monitoring blood glucose is also very important to understand how your body is functioning, and this can also help you to avoid risks and also intervene appropriately when your blood sugar is high or low. Taking your medications as recommended by your physician and provider is very important. Problem solving, healthy coping, and reducing risks include working with your community, your family, and your support group. Always reaching out to your primary care team before you come into the hospital. Avoid alcohol, avoid tobacco or the use of drugs, and always make healthy lifestyle choices. So you do have a choice. Readmissions to hospital can be avoided by most people with diabetes if you only take time to take care of yourself at home, as well as in the hospital when if and when you're admitted. Stay active and stay healthy. Thank you so much. If you want more information about what we have talked about today, please visit these websites: the American Diabetes Association, the Centers for Disease Control and Prevention, American Association of Diabetes Care and Education Specialists, as well as International Diabetes Federation, American Association of Clinical Endocrinologists. MyFitnessPal and Calorie King apps are also very helpful. Thank you so much.